Hey guys, Woodruff here. So I know that you're probably thinking if you're in complex that I've forgotten about you, but I have not forgotten about my complex people. And you know that is where my heart is a lot of the times, even though I've always lived in the med surg world as a teacher. My heart and soul always loves the complex stuff. So don't worry, I thought I'd create a little short for you guys too. I know you're learning about MIs this week, and if you're not at my school that I used to work at, I understand that this makes no sense, but just roll with it. But the point of this is just a little short to go over a practice question to help to start to get some strategy going and start looking at how you move and transition from, when you're doing like your med surge one or your first med surge. There is some like, hey, what's the first thing you need to do? What's going to kill them the quickest? But when you're working or doing, when you're learning about complex topics and you're learning about really sick patients, sometimes all the actions are helpful or needed, or sometimes it's like all the patients are dying, but which one's going to die first? Or all of the things could be harmful, but which one's going to be least harmful? So it's really hard. It's really intricate. So I'm going to just try to break down how you start really getting into that like life or death mindset. And that's really how you need to approach questions like this. So we're going to be talking about myocardial infarction in this question and prioritization with it. And some of these questions are going to be mine. Some of them are not going to be. So what do you call it? Just keep that in mind that I do my best to try to create some of my own stuff, but kudos to all those amazing writers out there who take the time to write these questions. Yeah, so the emergency department nurse is caring for a client who is just, and by the way, some of these are on my Google Drive too. So if you're seeing this and you're like, I already did this question. Well, you can always learn something a little bit more because maybe you did it, but you didn't do it high quality, because that's the other thing with this video is I want to show you high quality, how to really make one question into a lot of questions. Anyway, let's get it. Emergency department nurse caring for a client who was just admitted with left anterior chest pain, possible acute myocardial infarction. Which action will the nurse take first? So this is really, first, of course, I always like to read a question, say, what does it tell me to do? Or like, what is it asking for me or from me? And this is saying, hey, someone's coming with acute chest pain. What's priority? And like, really, this is saying like, which action is going to have the best benefit for the client or is going to help them to avoid death the most, the quickest, the best, etc. Like, which of these actions is going to have the most profound effect on the outcomes of this patient? Now, that's a really heavy question. So let's look at it, because probably all these things I'm going to do, but how do I decide which one? If you're someone who gets down to two, let's talk about it. So the first option is insert an IV catheter. So a good way to make this a good quality question is kind of recognizing, hey, this is a priority question, which means I'm going to do all of these things, but which of them am I going to do first? So it's good to kind of look at this, not just say like, hey, yeah, I need an IV, but maybe not right now. Well, what are we going to need an IV for? So with this patient that's having, chest pain, it doesn't matter where their chest pain is. Some questions it might, but this, usually we don't go that deep in nursing school. So they're having chest pain. They're going to need an IV catheter, maybe for a variety of things. Maybe they need some IV fluids. We might need to give them certain medications by their IV. Things like that. So that's important. But then the question I need to ask myself with each of these, because one real quick backing up is that by looking at each answer choice and seeing why I need to do that, I'm studying more for MI. So don't just look at this like I'm just answering this one question. What else can I get out of this question? I can also learn, why do I need IVs for MI patients? What might I administer to them? So we might do IV fluids. They might need IV nitroglycerin or different medications. So that's true. But is that the first thing I need to do? Like, if I insert this, if the IV catheter is the only action I am able to do, is that going to save the patient's life right now? Or is that going to have a profound effect on their outcomes? They're going to need one, but I don't think that the IV catheter goes in and all of a sudden their chest pain goes away. Because remember, chest pain means ischemia. My heart's not getting the oxygen it needs. They can die. So, it's very serious business. So instead of the IV catheter, yeah, it's needed. But is there anything else I could do before then that might have a little bit more of an effect? Let's see. Auscultate heart sounds. Well, I know a lot of, if you're one of those people that's very kind of like, I don't want to say rigid base, but like very, like you're organized in your brain, like type A personality, which I probably don't sound like I am. I am, because I mumble a lot and stutter sometimes, but a lot of times it's like, ooh, assessment first. We're always told we have to assess first, but does it make sense in the situation? If you listen to your heart sounds, is it going to drastically change the care you're going to give to this patient? Can you absolutely identify that they're having a heart attack? And can you also change their outcomes by listening to that? Now, do I need to listen to their heart sounds? Absolutely. But is there anything I'm going to hear that's going to actually help them to improve, help them to start having, to stop having ischemia? And that's what you really want to think about with MI. Is this really going to stop them from having ischemia by listening to heart sounds? Now, listening to heart sounds is important. There's things I might hear, but you can't usually hear a heart attack. You can hear damage from the heart attack to the heart, but you can't actually hear a heart attack. So, it's not going to necessarily help me to identify that they're having a heart attack. And it's also not going to stop the fact that they are possibly having a heart attack. So far, like both these actions, again, I need to do them. It might help advance the patient's care, but is it actually giving me what I need to help to prevent or stop ischemia and or identify what the problem is? The next one is administer sublingual nitroglycerin. So this one, it's, what do you call it? It's something definitely, patients that are having MIs, they need nitroglycerin, and it's a standing delegated order, et cetera, that you're going to see, often used in the hospital. Like if you're on the floor and your patient's having chest pain, this is usually one of the first things that we go to. So if I give the nitroglycerin, is it possible that it could change the patient's outcomes? The answer here is absolutely. This is, like we talk about time being muscle, time is heart muscle. And if I give nitroglycerin, one, if their pain gets better, their chest pain gets better, that's kind of like a ding, ding, ding. This has to be ischemia, because nitroglycerin is a vasodilator. It's only going to help chest pain if it's related to ischemia. And then two, it's also, even let's say they don't have some profound, I feel better now. Even if we give this and they don't necessarily feel better, it's going to vasodilate their coronary arteries, which if they're having a heart attack, it's going to help to increase the oxygen supply to the heart and help to decrease some of the over demand on the heart at the time that it might be going through. So this is a very important med to not only help to possibly, it can't necessarily officially diagnose a heart attack, absolutely not, but it can help you to get more on the right train to figuring out what's going on. Because a lot of times people come in with chest pain, but what they're actually experiencing might be something different, like GERD, reflux, stuff like that. So far I like 3 the best, because it seems like it's going to have a more direct right now effect, and really, because I'm really worried about their heart tissue, muscle dying. Last one is draw blood for troponin. So this is great to determine if they're having a heart attack or not, because if this is elevated, then it shows me that they're most likely had some sort of cardiac damage and or heart attack. However, I have to also think about, is this really going to change the fact that if they are having a heart attack, is it really going to change anything? So I see the numbers elevated. Yep, they're having a heart attack. Does it change the fact, like all that time it took to draw the lab and other stuff? Does it change that time that I've lost? That we could have been, opening up their coronary arteries and getting better oxygen to their heart and the rest of their body? No, it doesn't. So do we need to do it? Absolutely. So most likely, with this patient, we're going to start by administering the nitro. And I'm not saying like this is not a for sure thing, because I always hate those ordered ones, because sometimes it's like I'm doing all of them. Probably because really, honestly, simultaneously, someone's getting the nitro, the nurse is assessing their heart sounds, then someone is putting an IV in and drawing blood at the same time in the ER, if we're being honest here. But yeah, you really want to start with that nitro. So C3, whatever is the correct answer. And then we definitely need to, get that blood drawn, listen to their heart sounds, and insert that IV catheter. I'm not saying those in order, but we really want to look at like which actions are really going to have the most profound effect right now. And you want to think about what your priority is for MI. And again, priority for MI is getting that ischemia improved. That has to be top, because no matter what's going on, what their heart sounds sound like, how many IVs they have, what their troponin level is, if we're not stopping that ischemia, that cell, that tissue is dying by the minute. So we want to open up those coronary arteries as soon as we can. Hopefully this makes sense. I know this ended up being not as short as I had hoped, but I'm sorry, I got a little nerdy with cardiac. You know how I get. See you guys later.